Welcome to our overview of nursing in Indonesia. Indonesia belongs to the Southeast Asia region. For many years, Indonesian nurses were viewed as just assistants to physicians. However, the role of nurses has changed recently. Here are two examples. Nurses gained significant autonomy after the establishment of the Nursing Act in 2014. Furthermore, the COVID-19 pandemic spotlighted their essential role in community health, including their preparedness and participation. In terms of the image of nurses within Indonesia, there are problems with the public's perception of nurses. This issue underscores the need for public education to enhance the understanding and recognition of nurses' comprehensive professional roles and capabilities. The Indonesian National Nurses Association is the only regulatory body overseeing nurse education and services in Indonesia. The law of the Republic of Indonesia on Nursing Act was enacted in 2014, defining the scope of nursing practice, categorizing nurses based on education and expertise, and outlining professional ethics and responsibility. There are two main areas of concern for nurses. One is community-based healthcare interventions, focusing on non-communicable diseases. The other is community-based disaster management. In response to the high risk of natural disasters, nurses have been advocating for a sustainable CBDM approach that focuses on community empowerment through education and training programs. During COVID in Indonesia, nurses' roles extended beyond just administering vaccines. They manage the vaccine distribution, including maintaining the cold chain and educating communities about vaccine safety and efficacy. However, the mass immunization campaign encountered challenges like misinformation and hesitancy towards booster doses, often intensified by pandemic fatigue. In the case of the community-based disaster management project, as for perception of the preparedness, there is a huge gap between the CHN coordinators and CHNs. There needs to be advancement in knowledge, skills, and preparation of disaster management domains. The studies also emphasize the need for improvement in areas such as psychological intervention. Furthermore, the crucial involvement of CHNs in developing and implementing disaster plans is hindered by low professional recognition or gender biases against female nurses. In the community-based healthcare interventions project, nurses oversee and train community health volunteers, deliver health education, guide and delegate tasks such as conducting non-communicable disease screenings, assessing risk factors, and assisting with referrals. However, the project shows limitations in certain NCD screenings, particularly in vision examinations and prostate cancer checks, indicating areas for improvement. When compared with Indonesia, health outcomes in Canada benefit from a resource-rich healthcare system that provides extensive support to nurses. The public's high level of trust in this profession further contributes to more effective healthcare system. When it comes to similarities between the Indonesian National Nurses Association and BCCNM, both regulate nurse licensure, education and training, maintain high standards of nursing competencies, and define nurses' obligations. In terms of differences, BCCNM focuses on protecting the public, which means patient safety, ethical practice, and public trust are its purpose and priority. However, INNA, while also maintaining high standards, has a greater focus on supporting professional growth and career development for nurses. Country briefing findings are on the left-hand side. The commonality underscores the critical role of nurses globally in managing and mitigating such challenges. BC is proactively developing strategies to address these global issues. The attributes mentioned on the right-hand side are competencies that all nurses as well as entry-level RNs must possess. Lastly, we'd like to introduce you to this global health leader from Indonesia, Mustika Sari. Her combination of academic leadership, policy influence, research development, and advocacy positions her as a significant contributor to global health nursing, impacting not just Indonesia but also contributing to the broader global health narrative. Thank you for listening.